Making health and social care information accessible. Consultation questions. Summer, Autumn 2014. NHS England. Approximate recording time 15 minutes. You can skip through the tracks on this recording to find the beginning of each section. Introduction. NHS England wants to make sure that patients, service users, carers and parents receive information in a format that they can understand and communication support if they need it. As part of this, we are writing a new guidebook, or information standard, for health and social care organisations. This survey is part of the consultation on the draft standard. We would like to know what you think about the draft standard we have written before the standard is final. Please read the consultation document, which explains more about the standard, before you answer these questions. You can read the consultation document on our website at www.england.nhs.uk/accessible info. Or you can ask for a copy to be sent to you by emailing us at england.nhs.participation@nhs.net or telephone 0113 825 1324. The consultation document and this survey are available in a range of different formats, including audio, braille, British Sign Language and Easy Read. Please make sure that you return your completed survey to us by 9th of November 2014, as this is when the consultation closes. Thank you for taking part in the consultation on the draft Accessible Information Standard. Consultation questions. 1. Do you agree with the vision for the standard? The vision is explained in Section 3 of the consultation document. Yes, no, not sure, prefer not to say. 2. Do you agree with what the standard will do? This is explained in Section 4 of the consultation document and in the specification. Yes, no, not sure, prefer not to say. 3. Do you agree with what the standard includes? This is sometimes called the scope. What the standard includes and who will have to follow it is explained in Sections 5 and 6 of the consultation document, and the scope forms Section 8 of the specification. The scope is about right. The scope is too small. The scope is too big. The scope is missing something. The scope includes something it should not. Prefer not to say. 4. If you believe that the scope is too small or includes something that it should not, please explain here. 5. If you believe the scope is too big or does not include something which it should, please explain here. 6. What do you think about the steps of the standard and/or the requirements set out for health and social care organisations and IT suppliers? The steps of the standard are explained in Section 7 of the consultation document, and the requirements are detailed in the specification. The steps and/or requirements are about right. The steps and/or requirements are too small. The steps and/or requirements are too big. The steps and/or requirements are missing something. The steps and/or requirements include something they should not. The steps and/or requirements are wrong in some way. Prefer not to say. 7. If you think that the steps and/or requirements are too big or include something which they should not, please explain here. 8. If you believe that the steps and/or requirements are too small or do not include something which they should, please explain here. 9. If you believe one or more aspects of the steps and/or requirements is or are wrong, please explain here. 10. What do you think about the types of communication support and information formats we have included? These are listed in Section 8 of the Consultation Document and in the technical document which accompanies the specification. 11. Do you agree with quality considerations we have included? This is outlined in Section 10 of the Consultation Document and in the specification for the standard, Section 9.2, and in the implementation guidance. Quality considerations include things like the qualification of interpreters and how to make sure that information in different formats is correct. Yes, no, not sure, prefer not to say. 12. If you have comments on the quality considerations we have included, please explain here. 13. What do you think about the advice and support which we are planning to give to organisations? This is outlined in the Consultation Document Section 12 and in the Implementation Guidance, especially Section 7. The advice and support is about right. The advice and support is too small. The advice and support includes something it should not. The advice and support too big. The advice and support is missing something. Prefer not to say. 14. We are planning to give organisations 12 months to implement the standard. What do you think about this? 12 months is about right. 12 months is too long. 12 months is too short. Prefer not to say. 15. What do you think about our plans for making sure that organisations follow the standard? This is explained in Section 13 of the Consultation Document and in Section 17 of the Implementation Plan. 16. Do you have any comments on the specification for the standard which are not included as part of other questions? If so, please include them here. 17. Do you have any comments on the implementation plan for the standard? If so, please include them here. 18. Do you have any comments on the implementation guidance for the standard or support for organisations? If so, please include them here. 19. What do you think the impact of the standard will be? Very good. Good. Neither good or bad. Neutral. Bad. Very bad. Prefer not to say. 20. Due to the short timescales, we have to read everyone's responses and make changes to the final standard. We have limited the space for free text. If you have already given your views as part of the engagement phase, these have been considered in drafting the standard. If you do not feel that you have been able to share your views as part of this survey, please use the space below. We will try to consider any views you record in this section, but will not be able to respond or report on them in detail. Thank you for taking part in the consultation on the Draft Accessible Information Standard. Please email your completed survey to us at england.nhs.participation@nhs.net or post it to Sarah Marsay, that's spelled SARAHMARSAY, Accessible Information, 7NE, NHS England, Quarry House, Quarry Hill, Leeds, LS2 7UE. Please make sure we receive your completed survey by the 9th of November 2014, as this is when the consultation closes. For updates about the development of the Accessible Information Standard, please visit the NHS England website www.england.nhs.uk/accessible info.